something happened here. It's now or never. 'Cause something happened here.
Hi, everyone. Welcome back to Artemis Radio. I am Wendy from Artemis.
Hi, I'm Dr. Jun Chin.
So we're on episode 8, and this is a very, very interesting topic, I would say. This is about pelvic pain, and we're going to cover UTIs, we're going to cover painful sex, PMS, and everything else too. I'm going to let you pass the baton to you. So what exactly is like pelvic pain?
So many women come to me complaining of pelvic pain, and that's sort of an umbrella term. The pelvic pain can come from chronic urinary tract infections or UTIs. The pelvic pain can come from endometriosis, very big word. Basically, what that is there's abnormal growth of tissue outside of the uterus, and that creates painful periods. I mean, debilitating periods. It can lead to vaginal bleeding, not associated with your period. So you're just bleeding all the time. And then it's also associated with pain, like you might feel in your belly. You might have like digestive issues because it's so close, the pelvic organs with your digestive system. And then there's painful sex, and there's PMS.
Oh my gosh.
Mm-hmm.
I think sometimes just the word painful sex is very, I would say, glamorous in the pornography side, which is very focused on, the man having a, big penis and that's why it's painful. But we don't really talk about true painful sex, which is women just having all these symptoms that you just mentioned, I have chronic UTIs, and that's how, Dr. June and I started first working together in that sense. I've had UTIs for the last 20 years. Every time after sex, I would get a UTI. And it got to some point where I just became so embarrassed walking into another doctor's office, telling that story again, and then having usually a man who's a doctor, right?
Mm-hmm.
Actually, you know what? I don't think I think it's probably 90% of it was a man. And it's just very uncomfortable in that sense. And there were plenty of times where they looked at me and they said, you're the dirty one. Like you had that, or like they look at you, you're like, and you just get you feel so hopeless as you're trying to figure out why this is happening to your urinary tract.
Sure.
And I've been prescribed every antibiotics there is, and I've been, resistant to most of them too. And I'm just looking for an answer. And in addition to that, like I'm looking for maybe other women to talk about it, because I when I was researching UTIs, women get it all the time.
All the time. So common.
Right?
So common.
And after they get one, they get another within 6 months. And then they keep on getting more and more. And I just don't hear them talking about it as much. And it's just, I don't know how, I don't know what the solution or the conversation is in that sense.
Well, sometimes it's just physiological. Sometimes it's just the way your organs are shaped. Maybe your urethra is shorter or your bladder. Just there's some physiological reason why you get chronic UTIs. Sometimes it's a reaction to the contraceptive. So it could be the condom. Sometimes it could be the lubrication if you're using any outside lubrication. And sometimes you're just prone to it. It could just be, that's just part of your genetics and you get chronic UTIs.
Does UTI is it linked with just pelvic muscle spasms, or is it like, is the pelvic floor also the issue of why women get UTIs?
I'm glad you asked, because a lot of times women with chronic UTIs have a tighter pelvic floor. So their vaginal canal is just much tighter. Their pelvic muscles are just much tighter. I actually see a lot of chronic UTIs with dancers.
Oh, wow.
Because their core is so strong. Their pelvic floor muscles are so strong, so tight. They've trained, they've done Kegels, they've done, Pilates, up the wazoo.
Right.
Right, for training. And they tend to get chronic UTIs because you have that physiological response to those chronic pelvic muscle spasms.
So also, in addition to just the spectrum, you have the dancers who get UTIs, and then you also get the PTSD patients who get UTIs too as well. I remember when I was going to a pelvic floor therapist, most of the intake questions were about childhood abuse, and how you got there to get this. So it's like, I feel like the spectrum is so huge in why women would get something like this. Would massaging the pelvic floor or making it not so tight, I guess, help with the UTI issue?
So yes, some patients will go to what's called a pelvic PT, pelvic physical therapist, and they can do what's called vaginal visceral manipulation. They wear gloves and they do manipulation to the vaginal floor muscles. And sometimes that helps. Maybe not all is pleasant. It is quite painful. Sometimes they do massages in the pelvic area. So just on top of your belly, like right where the bladder is, between your hip bones. So they do go in deep into the psoas muscle and try to release it there. Sometimes patients find acupuncture very helpful. Sometimes certain breathing exercises to try to release the trauma. And trauma comes in all shapes and forms. And our pelvic diaphragm, right? So we have the way we breathe and the way we hold in trauma is through the pelvic diaphragm. And that's why it gets so tight. Because when you're in a fight or flight response, that core is activated and that core tightens up and holds on for dear life. And that's what causes some of the issues for pelvic pain.
100%. So I did everything that you just said. I went to a pelvic floor therapist and they did that. They went in and they massaged the floor. It is very uncomfortable. And also the top massaging part is very painful as well. And not only that, you have to go home and do it.
Yes.
Do your
homework, right?
Right? Like, so they give you a little tool and you go home and do it. And I just didn't know what I was doing. I didn't know I was doing it right. And I just didn't feel like I was under the care of someone that, at least for myself, I couldn't understand that for myself. So I wanted someone to be there when I was doing it. So it just makes the whole experience really difficult to try to thread out and to actually cure. Let's talk about PMS.
So PMS.
Yes. So it's a real thing.
Yes.
Okay, so I'll tell you something really funny. It's not really funny, but it's kind of funny. Couples who walk into the store, we have a dedicated PMS section, right?
Oh, good.
Yeah, because it's a real issue. And couples who walk to the store, the guy always points at the PMS section and like giggles a little bit. And there's the girl going, it's a real thing. So then it's like going back to what we're saying,
Stigma.
right? Yeah. And it's like, oh, you're moody. PMS, it's always pointing to that. And we're like, no, it's actually a real physiological issue. It is painful for a lot of women.
Yeah. Sometimes women can't go to work, right? Sometimes it could be really, really painful. It can cause sweating, clamminess. It can cause nausea. It can cause the headaches and migraines we were talking about before because it's a hormonal issue. There is a flux in estrogen and progesterone. There is pelvic pain associated with it and all the other physiological responses with it.
So how can we help with the CBD aspect of things?
So what's wonderful, again, is CBD is an anti-inflammatory, right? So it takes away inflammation. Pelvic pain from chronic UTIs, from painful sex, from trauma, PMS, endometriosis, excessive bleeding, all that stems from chronic inflammation. And there's tons of cannabinoid receptors in your pelvic region.
So just full disclosure, when Dr. June was helping me with my UTI, I actually tried tinctures. I actually did it 3 times a day, and it was more than my usual because the pain was so awful. And I noticed that when I was on, I had a patch on. Near that, I took a capsule and I also took a tincture too.
Okay.
And for anything that was like really acute pain, I would just take the vape. So I wanted to do everything because I wanted to try to make sure that I can keep this pain under control. And I remember the first day doing it, I was logging everything. The pain started at 5 and went out to 1, right? The urination, the act of urinating was still painful, but the pain associated with that went from a 5 to a 1. And I felt, and it was really hard for me to describe, but it felt like little fingers massaging my pelvic area. Am I hallucinating, or is that what's happening down there?
Right, because it's decreasing the muscle spasm and decreasing the inflammation. You happen to be really in tune with your body. People that are in tune with their body can feel the little nuances, their body changing. So that's what you felt. It was actually working for your body.
Right. So it did, I logged it. I did it for 5 days. the UTI didn't go away, but the pain did. So it would spike again when the urination part, then it would just kind of come down back again because I was treating it with the CBD tinctures and everything else too.
So you still for UTI, for an infection, essentially you still need the antibiotic, right? So you don't want to try and treat it only with a cannabis-based product or a CBD product because you don't want the infection to spread to your kidneys and to move up your bladder. Yeah.
Yes. No one wants that.
Yeah.
That's Because
so the other option, in addition to tincture, vape, or capsule, is suppositories, CBD suppositories, cannabis suppositories, which they do make on the West Coast. We don't have that here. Oh wait, I think one medical dispensary carries it, but you won't really find it here on the East Coast. But it's an infused suppository with cannabis products.
And you're putting this up your vagina.
Correct.
And then that will help with the pain and the spasming.
Yes, the localized pain and spasming.
In regards to pelvic pain, UTIs, and PMS, you think?
Yes. So it's just an alternative to not ingest anything. So when you use a vaginal suppository, you won't get high. You won't feel side effects.
But it still enters your bloodstream.
It does enter your bloodstream, but it's helping the localized area. It's calming it down. So patients will say, hey, I feel really tingly down there. I feel like there's little massaging little hands.
Right.
And that's because the anti-inflammatory, anti-muscle spasm of the cannabinoid is working localized.
Around that area, basically.
Yeah, because that area is on fire, essentially.
Yes!
Right? Yeah.
No, that's exactly what it feels like.
It's on fire.
Yeah, it feels like when you're urinating, it feels like you're just peeing fire.
Yes.
But that's not it. Like, you have to do it again 2 seconds later. And it just has this onset of, it comes back and back. Like, that's the UTI,
yeah, girl.
aspect. And women feel this all the time.
I don't know any woman who's never had a UTI before.
And it's not pretty for chronic UTI patients too, or, that you're treating. It's just, it feels like a lost cause because it keeps on coming back. And also, you don't want to change, your sex life. You want to be able to at least have a healthy sex life with your partner.
Sure.
And for me, like, I associate pain with sex because I gotta go get it treated, and then I would time myself. How many antibiotics can I take so then I can push back, to the next cycle in that sense, And it's just, it's not a very healthy way of living in that sense.
Right, and then chronic use of antibiotics will give you irritable bowel issues. Will wreak havoc on your GI system, your digestion.
Is this why I feel the way I do now?
Right, so if you might develop like extra bloating or digestive issues to certain foods or sensitivity because you've had chronic antibiotic use.
I've never felt not bloated.
It's from the chronic antibiotics, most likely.
Okay.
I think we could save the irritable bowel.
This is another
podcast
conversation, but
with
I didn't realize this. Going back to PMS, do you think they'll ever make a tampon that's coated with like CBD?
That's so funny you asked that. Harvard just started a study, 400 women with cannabis-infused suppositories. I call it weed tampons.
Oh, wow. I like that.
For women with pelvic pain and PMS. So I think that's the future.
Is that a tampon, or is it just a suppository to help relieve the symptoms of PMS?
I don't think they're like dousing the tampon with cannabis products. I think they're creating an actual suppository.
Got it. I think it'd be kind of cool to have an option like that with your tampon. So then you can have that extra relief, I guess.
Wow.
If you do this, if you do the suppository.
You're a total entrepreneur.
And then you have the tampon too. And I think it's whatever relief we can have for a topic that doesn't get talked about. I think that's hopefully the future.
Yes.
Yeah. But thank you so much for that. This is a great topic, and I'm so happy that we went through this. But please, if you have any questions, or if you're looking for answers as well with your PMS symptoms, UTIs, anything that maybe it's uncomfortable to talk about, you can DM us privately, and then we can hopefully address that too as well if you don't want to leave a comment in a public forum like this. But thank you so much for joining us today. Dr. June, it's always great to have you here, and we will see you in the next episode.
Thank you. Bye-bye.
Bye.